Hello, and welcome. Today, we're diving into a fascinating, yet often misunderstood, eye condition called Salzmann's nodular degeneration, or S&D for short. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started on unraveling this corneal mystery. The exact cause of Salzmann's nodular degeneration remains somewhat elusive. However, it's generally believed to be triggered by chronic inflammation or irritation of the cornea. Common culprits include conditions like dry eye syndrome, chronic blepharitis, inflammation of the eyelids, and past corneal injuries or infections. Basically, anything that causes prolonged stress to the cornea can potentially contribute to its development. It's also worth noting that in some instances, no specific predisposing factor can be identified. Let's talk about what's actually happening at a cellular level. In Salzmann's nodular degeneration, the normal structure of the cornea is disrupted. Abnormal deposits of collagen and hyaline material accumulate beneath the corneal epithelium, which is the outermost layer of the cornea. These deposits form the characteristic nodules that give the condition its name. Over time, these nodules can distort the corneal surface, leading to visual disturbances. In some cases, the basement membrane of the corneal epithelium can also thicken, further contributing to the irregularity. Salzmann's nodular degeneration isn't considered a particularly common condition, but it's also not rare. It affects people of all ages, although it's more frequently diagnosed in older adults, typically those over the age of 50. Women are also affected more often than men. However, due to the often subtle nature of the early symptoms, it's possible that the true prevalence of S&D is underestimated. The signs and symptoms of Salzmann's nodular degeneration can vary greatly depending on the size, number, and location of the nodules. Some people may experience no symptoms at all, especially in the early stages. Others may notice blurred vision, a feeling of something being in their eye as foreign body sensation, dryness, redness, and light sensitivity. In more advanced cases, the nodules can significantly distort the corneal surface, leading to significant vision impairment. Sometimes, patients may experience recurrent corneal erosions, where the surface layer of the cornea breaks down, causing pain and discomfort. Diagnosing Salzmann's nodular degeneration typically involves a comprehensive eye examination by an ophthalmologist. Using a slit-lamp microscope, the doctor can clearly visualize the characteristic nodules on the cornea. Corneal topography, a mapping technique that measures the curvature of the cornea, can be helpful in assessing the degree of corneal distortion. In some cases, confocal microscopy, which provides a high-resolution image of the cornea's layers, may be used to confirm the diagnosis and assess the extent of the disease. While there aren't distinct classifications or official types of Salzmann's nodular degeneration, the condition is often described based on the location, number, and size of the nodules. It can be unilateral, affecting only one eye, or bilateral, affecting both eyes. Some patients may have only a few small nodules, while others may have numerous larger nodules that cover a significant portion of the cornea. The severity of symptoms often correlates with the extent of the nodular involvement. The treatment for Salzmann's nodular degeneration depends on the severity of the symptoms and the impact on vision. In mild cases, artificial tears and lubricating ointments may be sufficient to alleviate dryness and irritation. If inflammation is present, topical steroid eye drops may be prescribed. For more significant cases, where the nodules are causing significant vision impairment, surgical removal may be necessary. Several surgical techniques can be used, including superficial keratectomy, where the nodules are carefully scraped away, phototherapeutic keratectomy, or PTK, which uses a laser to remove the abnormal tissue, and lamellar keratoplasty, a type of corneal transplant where only the affected layers of the cornea are replaced. Unfortunately, there's no guaranteed way to completely prevent Salzmann's nodular degeneration. However, managing pre-existing conditions like dry eye syndrome and blepharitis can help reduce the risk of developing the condition. Protecting your eyes from injury, especially in work or recreational settings, is also crucial. Regular eye exams are also important as they can help detect early signs of corneal problems and allow for prompt treatment. The prognosis for Salzmann's nodular degeneration is generally good, especially with appropriate treatment. Surgical removal of the nodules can often significantly improve vision and alleviate symptoms. However, there is a risk of recurrence, meaning the nodules can sometimes grow back. Recent research has focused on improving surgical techniques to minimize recurrence and developing new medications to prevent the formation of nodules in the first place. Ongoing studies are also investigating the role of inflammation and other factors in the pathogenesis of S&D, which could lead to new and more targeted treatment strategies in the future. Thanks for joining us on this exploration of Salzmann's nodular degeneration. We hope this information has been helpful and informative.